time to talk about what's going around, and each week we bring in a local medical provider to find out what kind of issues they're seeing in patients lately. Well, Jennifer Arnold's here with us from Immediate Care Pelham, so thanks so much for coming in this afternoon.
Thank you for having me.
Now, it's pretty crazy because all summer we've been talking about swimmer's ear, poison ivy, poison oak, and it's kind of crazy to be talking about the flu.
Already.
And you guys have already seen flu patients at your clinic, right?
We have. We've seen about 4 or 5 in the last 3 weeks. And we were really surprised to see them test positive, but they were there. So hopefully that's a fluke.
Yeah, and there's the flu shot's not even out yet, right? That's not even an option at this point.
It's not out yet, and typically those will come out in September. And actually you want to wait until about October, early or mid-October, to get your flu shot.
Now, and of course, you get the flu from somebody, correct? I mean, it's kind of passed
Right.
on. So, I mean, these people were they traveling? Is it here? I mean, have you guys got an idea yet of what?
I was looking for a trend. I was looking for any reason that, please tell me it's not right here in Greenville. But I didn't see any one common, thread between them that, it must have been them traveling. So I didn't see any reason for it so far.
Yeah, I was reading that in the notes. It's just something I was not expecting to see the 1st of August already. Hopefully that's not a trend of what's coming.
I know.
So what would say people, I mean, since you guys seen those cases, is it just, start getting those symptoms, you should go see you guys? What do you guys tell people?
So typically you first start seeing with flu, since it's a virus, you'll see those viral symptoms of body ache, chills, fever, cough, headache. And so the ideal thing to do is within 48 hours of having those symptoms, they would come in, be seen, be tested, and if it is positive, then there are antiviral medications that we can prescribe, and that should decrease the symptoms and decrease contagiousness and hopefully shorten the virus. But then we try to tell people to also stay out of work, keep kids home from school. That would be a great way to decrease contagiousness and keep other people from getting it.
Especially with people going back to school. I mean, at this point, just a couple of weeks. So
yes.
Hopefully this is a fluke. Anything else you guys have been seeing lately at you guys' clinic?
A lot of other viruses that are mimicking the flu, a lot of other body aches and low-grade fevers. And of course, as school is starting, we're going to start seeing strep. We're going to start seeing more of those viruses going around as well, probably the stomach virus. So, of course, everybody wash your hands.
I was going to say, that's kind of the number one thing to do to try to prevent it, especially in children.
Number one rule is wash hands and don't go and spread germs at work and at school.
And what advice do you give parents? I mean, it's kind of a good time to talk about it. In a couple of weeks, we're going to be doing tons of back-to-school coverage. Some schools already going back in our viewing area. I know Georgia's back. But what advice do you tell parents? I mean, I know it's hard to keep them from getting sick, but what do you guys tell when they come in?
Truly, wash hands all the time. And if you can teach your kids to wash their hands at school, that's hard enough to teach our kids to wash their hands at home.
Right.
But then, it's never a bad idea to do a children's multivitamin on a daily basis. And then, plenty of rest, get plenty of sleep, just all of the basic things really. But washing hands and just not going to school and work when you're sick are the biggest things.
See, I think that's the big thing is stay home. I know it's hard in some businesses, but it's like employers, but I mean, stay home. That's, I think, the number one way it gets worse.
Don't spread it, absolutely.
All right, well, hey, thanks so much for coming in here, and hopefully this flu thing is a fluke.
Absolutely,
we don't want to start
fingers
talking about
crossed.
this. Thanks so much. All right, well, right now we'll send it back over